You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in facelifting techniques? My first guest is a board-certified facial plastic surgeon who specializes in a natural-looking facelift. If you are considering a facelift or you just want to look younger, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Corey S. Maas, MD. Dr. Maas is board certified by the American Board of Facial Plastic and Reconstructive Surgery. He is the founder and medical director of the Maas Clinic in San Francisco and Lake Tahoe. He is here today to discuss the keys to a natural-looking facelift. Dr. Maas, welcome to the show.
Thank you for having me, Randy.
Now, we've had you on the show talking about minimally invasive techniques, but for those that don't know you, tell us about your background, your training.
Well, I did my medical school training in Florida at the University of Florida, and then went on and did head and neck surgery training in St. Louis. Finished my plastic surgery training at the University of California, San Francisco, in San Francisco, where I stayed on the faculty there as the director of the facial plastic surgery program for about 12 years.
Teaching other surgeons facelifting techniques, facial rejuvenation?
Teaching primarily facial cosmetic surgery to medical students, residents, and fellows, advanced training, and I still do that on a almost daily basis.
Tell me about the Maas Clinic.
Well, we have locations in San Francisco, our primary location, and a satellite office in Lake Tahoe, and we're 98% cosmetic facial surgery.
Who's your typical patient that goes to see you?
Well, we see patients of all age ranges, from in their 30s up into their 80s. But typically people who are coming in to seek rejuvenation for changes associated with aging or balancing their facial features.
Now, when you speak in terms of balancing facial features, and we've talked a lot off camera, and you have almost a philosophy, I guess, about facial rejuvenation. Tell me about that.
Well, I think there are a couple key things. The first one, of course, is that everybody's different. And historically, there was a sort of a cookie-cutter approach to plastic surgery. You did the procedure this way, everybody had a little scooped-out nose, everybody had the same facelift. You could almost name the patients off the street their doctor from the cookie-cutter approach to this. The other philosophy that's very important, balancing facial features, and is restoring youth. Because as our population ages, remember, we weren't really programmed to live to be 100 years old, which is what most of us are going to probably live to in that range. We were probably programmed to live to be about 50. Now, 50 years ago, when you were 50, you had one foot in the grave. Now when people are 50, you know, they're just starting to have fun.
What has changed then and we're speaking specifically about facelifting. How have views, philosophy, techniques changed in the past 20 years?
Well, remember, facelifting is in terms of what we think about now, facelifting is a fairly new procedure. It wasn't really into the mid-70s when it started gaining some popularity, and even the doctors that described the original facelift were sort of shunned by the medical community. As we've evolved, we've seen a whole bunch of different procedures described as facelifts, and I think it's important for people to understand that not all these facelifts are good for everyone.
Okay.
And so what we've learned is that different facelifts, as they're described by the media and in the literature that people are reading, are not good for every patient.
Okay, but I still see this smeared look. With all of the advances, I see that tight, pulled back, phony look. Is that in the surgeon's hands? Is it the healing process?
Well, you're right on. I mean, part of this is that some of the older techniques where there was just skin being pulled as tight as it could be pulled give these people the sort of windswept, stretched look, very unnatural, and in my practice, that just doesn't
But that's going on today.
It is going on
today. I talked to a plastic surgeon. We talked that he says all you do is to pull the skin. Why is that a mistake, in your view?
There's many reasons. The first one is it's not going to last very long. Just pulling the skin up. In fact, Pissot, a famous plastic surgeon from the early 1900s, described the so-called S-lift, which gained some popularity a couple years ago, and all they were doing was making a little S-shaped incision, pulling the skin back, taking a little out, and sewing it up. The problem with these procedures is twofold. Number one, it's not going to give a natural restoration of the contours of the face. It's just going to make the skin look tighter and pulled. And number two, it's not going to last very long. The skin is elastic, it will relax back, and you'll just get a short duration improvement.
What defines a facelift?
Well, I think, Randy, the facelifts are not, as I was describing earlier, there are many descriptions of facelift, and I think the public has some misunderstanding about it, partly our fault because we don't describe it well. But traditionally, physicians describe a facelift as a surgical procedure that addresses the lower 2/3 of the face. That is the cheek, the lower jawline, and the neck areas. That's what a facelift addresses. It does nothing for the eyes, or not anything substantial for the eyes. It doesn't do anything for the brows. Now, in subcategories, we can do things like neck lifting alone for a patient who just has a loose neck. We can do, and in fact, more recently, we've learned that facelifts themselves don't do a good job on this mid-facial wasting where the eyes kind of sink down, the fold gets deep here. So mid-face lifting has become very popular, and in fact, in our practice, we've championed a procedure called the percutaneous mid-face lift, which involves minimal dissection and sort of lifts that fold up. This traditional facelift doesn't do a good job of that.
I've been told 10 years ago, and I could be wrong, that you were not addressing the mid-face.
That's correct. Up until recently, the mid-face was largely unaddressed. You certainly would get good contour of the jawline and neck area with our facelifting techniques.
So how has that changed the result, the appearance of a facelift?
Well, again, it gets back to what we were talking about before with balance and harmony. We were able to restore the jawline, the lower face and neck area, but then we still have hollowness under the eyes and the deep fold. We can add a percutaneous mid-face lift, what we call a mini cheek lift, and do it alone, or we can do it with a facelift and really help to restore the cheekbone area, the fullness under the eyes that's lost as what we call a negative vector, where those fat tissues drop down below the eye and create a deep fold and hollowness.
Okay, now, if you're not just pulling skin, tell me what you're doing. What goes into a facelift?
So the key to a facelift, first of all, I think that we have to address some of the misunderstandings.
Okay.
It does not take weeks or months to recover from a facelift. When it's done properly with the right technique and some skill and artistry, the patient can be back doing normal social functioning things in 10 to 14 days.
Somebody could have a facelift, 2 weeks later they're fine.
2 weeks later they're at a party. They're doing their normal social things, whatever they want to do. So the myth about it being weeks or months of recovery, in fact, in some of the techniques that are being used today, these deeper dissections and all the more extensive procedures, which really have proven not to last any longer.
So what do you say to those surgeons that say the only way to achieve a natural-looking facelift is to go deep? Well, aggressively go one of these deep plane facelifts.
Well, there's nothing wrong with working in the deep plane, and there's a lot of misunderstanding even amongst surgeons about the deep plane. For us, the deep plane is working in the muscle layer, but we use the muscle layer to recontour the tissues. That's where the pull is. The pull is not on the skin. It's working in that muscle layer, the layer that we call the Maas layer, not related to my name.
Okay.
It's the Maas layer. We pull on that layer, that's where the tension comes. It's restoring that muscle layer to where it was when the patients were younger.
So you're repositioning the muscles, the underlying tissues?
Well, not the muscles themselves, but the muscle layer. It's a very thick connective tissue. It allows us to recontour it. It's what's really sagging down. Once that's recontoured, we can simply just redrape the skin with minimal tension on it.
Are you pulling up? Are you pulling back? What are you doing?
Well, that's a good question, because I think a lot of people think that you're just pulling straight back on the face or the skin. And in fact, the best results are achieved for natural contour. And this is the key. We want to have a facelift that looks natural, looks like you did when you're younger, not like you had plastic surgery.
I could always spot one, though. I could spot a facelift. Now that I've interviewed some plastic surgeons, I feel like I could spot one 20 yards away.
If you can spot it, it wasn't done well. That's my answer.
Is that right?
A good facelift, you can't tell the patient's had a facelift. And the way we do that is by contouring in multiple vectors. We're not just pulling straight back. We're using that muscle layer that I described to you. We're pulling in multiple vectors to restore the natural.
Multiple vectors meaning what? Directions?
Multiple directions,
okay.
Yeah. They're a vector of pull. There are multiple directions of pull on that muscle layer to restore the natural contours of the face that the patient had when they were younger. Then we can simply redrape the skin with minimal amounts of excision of the skin itself, minimal amount of pull in the skin itself, and get a very, very nice natural facelifting result that looks great.
What about the incisions? Where are you making those?
That's a good question, Randy, because there are people out there that are surgeons that are out there that are very dogmatic about an incision needs to be in this exact place on every patient. I don't agree with that. I think it depends on where the patient's hairline is. Some men and women have a lower hair tuft here. And if they have a lower hair tuft in this area, we're able to make an incision behind the hairline. So
Are you able to hide them?
and we can hide it completely in that way.
Okay.
For patients that have a higher hair tuft, we're going to follow right along the hair with a little wavy line. The incision is barely visible once it's healed up. Same with behind the ear. You can wave it along the hairline itself, or you can go back in. Typically back here, if they have enough hair, we're going to go into the hairline. We're going to hide the incision behind the little piece of cartilage here called the tragus. So there's virtually very little of this incision that's going to be visible to the naked eye because it's all hidden in lines, creases in the hair.
Okay, now if there's a mistake, and you teach, clinical professor, facial plastic, if there's a mistake being made by maybe surgeons without a lot of experience, or maybe they don't have that eye that we've talked about, what mistake is being made when we're talking about facelifting?
I think the biggest mistake is sort of overdoing the facelift, removing too much tissue, trying to pull too tight, which results in lots of things. First of all, a stretched look, which is unnatural. Secondly, they can have wound healing problems, excessive bruising, and all these kinds of things. So the key is there's an artistic eye to this to make sure that the contours are appropriate, that the skin is properly redraped. And so I can't say that there's just one simple answer. It's sort of the global picture, and it gets into what we were talking about earlier, Randy, and that there's some artistry in this. It's just not a I mean, if we were just...
So some guys have it, some guys don't.
I think that's true. I mean, a lot of surgeons are technicians, they're excellent technicians, and they don't have the artistic sort of approach to this.
What about patient with expectations of just remove every wrinkle from my face? Do you step in and slow them down, say maybe this is not the best thing to do? Yeah,
and that's a very important part of the consultation. One of the reasons why when patients come to our office, we take a digital image of them, I put them on an imaging machine, and I show them what the results can be for different procedures.
How realistic is that, though?
That's very realistic if it's done well. Obviously, I can take someone's nose and put it on their forehead on a computer, but I can't do that, in practice. So my job is to show people what is a realistic expectation for outcome. And if I can get agreement with our patients on what those are, then we're all going to be happy at the end. Some people, as you were mentioning, have very unrealistic expectations as to what can be achieved, and it's my job to explain what's doable and what's not doable.
So what do people say? Woman 70 years old goes in for a facelift, maybe their spouse. How much younger can they look?
Well, it depends on the patient.
What do you hear? What do you hear?
Well, I
typically
think, in general, patients that come in can turn the clock back 10 to 20 years easily with a facelift. It really depends on the patient. Some patients, when they're 50, look great. They have a great jawline. They don't even need a facelift.
And you say people won't notice. How could you not notice if you look 10 years younger?
That's the beauty of it. The common response after these kinds of procedures is not, oh my God, she had a facelift, or he had a facelift. The common response is, gosh, you look great. You look rested. You've been on vacation. What have you done with your hair? New makeup. These are the kind of responses that we want to get. There is a process in the brain called imprinting. It's why when we look in the mirror every day, we don't really look very much different, but if we look back at a photo from 10 years ago, we look pretty different.
Okay.
And that's what happens when people see us. They kind of imprint the face. They say, gosh, she looks great. I don't know why, but that's
so your
just
friends
that
may
person.
not even know. You're saying after a Dr. Maas facelift.
I've had many friends of patients, not only friends, but their families not even know. They look great, they can't tell why. And that's what you really want. You want natural, long-lasting results that people can't even tell. Plastic surgery should not look like you had plastic surgery. It should make you look younger and better.
So that pulled back tight look in the hands of the surgeon.
It's in the hands of the surgeon.
Okay, we're going to take a quick break. When we come back, your photos. Let's take a look at some of your work and what you're doing. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking to plastic surgeon Dr. Maas. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. With us, we have board-certified facial plastic surgeon Dr. Corey Maas. Dr. Maas, okay, you brought some of your photos, before and after facelifts. So again, give us a recap, the keys to a natural-looking facelift.
Well, I appreciate you letting me do that part of it, Randy, because I think it's so important that people don't understand sort of the process. And what I would like to be able to do is sort of show you what people ask about and what the process looks like, how we make an analysis and how we look at the patient.
Okay.
So if we go to our patient here, there's a very good example. This particular lady is very interesting because she's a lovely person inside and out, and I can see on her face. I can see right through a lot of the lines and wrinkles.
So what's going on there?
She's got concerns primarily about her lower face. We talked to her about her upper face. She's got some drooping of the eyebrows, which gives her sort of an angry, worried look. Now, Randy, look at the after photo.
Wow.
You can see that her jawline is restored. It's a nice curvilinear
Huge
jawline.
difference.
She's got a very nice soft neck contour, as you can see here. She's got a lot of, all those wrinkles or sort of parenthesis lines around her face are completely restored.
And how did you do that? That just...
Again, that is part of the technique and part of the art of this. There's no simple answer. Everybody's a little different, but it's primarily working on the muscle layer, the layer of thick connective tissue under the skin, restoring and recontouring those facial tissues that sag and become loose as we get older.
Now, she looks 10, 15 years younger. This is a woman. If I saw her walking down the street, the after, I wouldn't think she had something done.
Well, that's the key. You do not want to have a patient that looks like they had something done. You want this patient to look younger, more natural, more refreshed.
Show me another photo.
Well, let's go to, this is a great patient, Randy. I want to show you a good example of a neck patient, a patient that has a concern about her neck. And if you look at her picture, you can see that what happens is you lose the angle of your neck completely. I mean, her chin goes straight down to her chest here. She has this deep jowling effect here that comes down and circles right over her jawline. It becomes an irregular sort of S-shaped curve here. So this is how people see us. They see us from a 3/4 or side view. We don't perceive ourselves that way because we look straight on at the mirror.
Is that a facelift or just a neck lift?
This is a facelift. This patient had a lower 2/3, which is a cheek and neck lift together, a procedure we talked about earlier in terms of technique, and it addresses those issues we talked about. The deep fold here, the jowling, the irregularity to the jawline, and then the redundant tissue in the neck here.
Did you also get rid of some of the redness in her face? I see a difference there.
This is a patient who's also had one treatment with intense pulse light, one treatment after, which we commonly do. We offer our patients complementary treatments with intense pulse light. We want to make sure they look great. So we want them to start on IPL and get rid of a lot of that brown and red to really get this right.
Let's look at another photo.
Well, this is a good picture because more and more men are coming in for this type of surgery, Randy. I don't want anyone to think that this is just about women's surgery. Men are coming in all the time. They want to look better. They're living older just like women are.
So this is a guy that I would not guess would ever do anything.
And that's exactly right. He's a grandfather, but he doesn't want to look like a grandfather.
Okay.
He doesn't care about his eyes. He doesn't care about his brow. These are all things that you could address on somebody in this age range. What he cares about is his waddle. He cares about the neck hanging down, the jowling on the side of his face. He feels like he's 40. He doesn't want to look like he's 80. And so when he came to me, he said, "Doc, listen, I'm not worried about cosmetic that much, but look at this thing. You got to help me out." I mean, this is really where he was at.
Okay.
And if you look at him, if we take a look at the photograph of him, we can see that, again, this patient has a neck that just sort of drops straight from his chin down to his chest. He's got a big jowl that comes down here. His jawline is completely irregular. And this area is really where he's concerned about. This is what he wants taken care of. Now, a lot of people talk about scarring after surgery.
Sure.
And when we go to the after picture, Randy, I want to show you that this shouldn't be a concern even in men.
Okay, so with the, well, now when you look at the after, where'd you put his incisions?
So in men, it's a little different than women. We can't go back behind here because we'd be pulling some hair-bearing skin back. We'd be pulling some of his beard back behind his ear. But we can make an incision right along the ear here in a natural crease. And even if we blew this picture up, Randy, I would challenge you to find the incision here. It heals beautifully when it's done correctly, and it's back behind the ear and hidden, and we've restored his contour of his jawline. We've given him back a neck angle, as you can see here, and we've eliminated this sort of jowly effect in the area by the corner of his mouth. And that's what he wanted.
He looks like a younger version of himself.
He looks like a younger, more vibrant, and the key about facial features is as we lose our jawline, as we lose our neck contour, our faces get weaker. We don't project ourselves the same way as we do when we're younger. So a strong jawline, good contour along what we call the mandible here, and a neck angle are important in how we project ourselves, how we're perceived by others.
Okay, let's take a look at another.
So take a look at this woman, Randy. She is a lovely person, and here's her picture before any surgery. She has a history of a cleft lip and palate, which was repaired very nicely in her youth. She's got a very high painted sort of arched eyebrow here, and that's, you know, part of where she wants her eyebrow. This is before any surgery. She's got this negative vector we talked about, how the cheeks look hollow. It looks hollow underneath her eyes here. She's got a deep mound here occurring in her mid-face area, and a fold here that extends down below her jawline, giving her that jowling appearance. This is a mass of tissue that's coming down.
A lot of wrinkles on the chin.
A lot of wrinkles on the chin and neck, and then you can see these bands that are occurring here. These are bands of muscle that thicken as we get older. So we're going to address all those things in our surgery that we're describing.
And what were her goals? She just wanted to look younger, fresher?
She wanted to look younger. This is a nice lady whose husband had died, and she was back looking for companionship, and just felt like she looked too old to be able to go out and find a man. She wanted to sort of get back in the mix. So she was interested in something to help her with a life change, but she had reasonable expectations. She didn't think it was going to make her life a lot different. She just wanted to look a little better so she could get back in the scene.
Okay, let's look at the after.
So if you look at the patient's after picture, here we've restored her jawline.
Great.
We've lost all this wrinkling effect that you see here, all the extra jowling. She still has sort of high brows, but that's where she started from. But we've really recontoured the brow so that there's not all the redundant tissue here. And then most importantly, you can see that her mid-face is full again. She doesn't have this hollow negative vector.
How did you accomplish that?
We talked a little bit about with a facelift, we can do that mini cheek lift, that mid-face lifting procedure at the same time as we do the facelift to restore the vector in the mid-face, that sort of sagging of that mid-facial tissue. So look at this three-quarter view, Randy. I mean, this shows a tremendous benefit on this patient who had just a lot of soft tissue hanging down over her jawline. It almost makes the patient look sad. It looks like everything's pulling down. Her eyes look sad here. Everything, just very, very much a negative vector of soft tissue. And then we've restored her contour of her jawline, certainly improved her mid-face, how hollow it looked over here in her before picture. And in her after picture, she's got nice fullness to her cheeks, a nice contour of the skin, and
you
lots
see
of
this
these
every
wrinkles.
day.
This is the kind
I mean, these are extreme makeovers.
No, they're extreme makeovers, but the funny thing about the extreme part is that when I watch the show, I see people recovering for weeks or months. These patients look like this in 10 to 14 days after the surgery. The recovery doesn't need to be extreme.
Because of your approach.
Because of our approach. Because of our technique. That's right.
They don't have to be out for a month or 2 months.
If the patient, all of my patients hear the story, and they should, they will be doing normal social functioning things within 10 to 14 days after the procedure. That's the key.
And there are people, I guess, that are healing for 2 months, and they don't have to be.
Depending on the technique, there are patients that are recovering for months and months and months after the surgery, and that's really unnecessary. We can get these results with good, long-lasting duration of effect without having that kind of recovery period.
What about the younger patient?
Well, let me
show
you some examples of that, Randy, because I think that not everybody's coming in with severe jowling. Some patients come in with less jowling, and they certainly should be addressed. If you want to look at an example here is a patient who is younger. She's got, again, this negative vector, this sort of hollowing out of the cheek area here. See there's a groove right here. There's a deep fold that almost looks like a C-shaped line that goes from her nose all the way to her jawline. And then while her jawline isn't nearly as severe, she's sort of got irregularity to it here, and then this redundant skin in the neck.
Now this person doesn't look like they need much.
No, and they don't necessarily need much, and that's why they should be recovered in 10 to 14 days to get the result that they want. So if we can look at the photograph of her after picture, you can see that we've recontoured the jawline.
Well, that's not pulled and tight.
And it shouldn't be. This lady should look natural. She should be able to go out and have people say that she looks great, she looks rested. Has she changed her hairstyle?
Got rid of the jowls, cleaned up the neck,
the neck looks got a nice angle, nice strong jawline. She's a professional lady. She wants to be effective at work.
Now these people had a lot of things going on, neck, jowling. What about just the mid-face? They're dropping in the mid-face, and you talk a lot about that. What do you do there?
Right, and I think it's important to understand that some patients don't have all this stuff. The mid-face may drop earlier and may create these deep folds and the hollowness under the eyes before you get neck problems, before you have a loss of your jawline. And this percutaneous mid-face lift, this mini cheek lift that we've described.
Called a cheek lift? What do you call it?
I call it a percutaneous mid-face lift. And mid-face lifting has gone through a whole evolution in plastic surgery. There are people describing coming through the hairline and elevating the tissue off the bone and going behind the eyelid and lifting up the tissue off the bone. We're doing this with tiny little incisions in the cheek here, just a little punch, and behind the hairline a little incision. And we're able to elevate this thing without all that recovery or dissection. People can come in the office and do this if it's just the mid-face alone.
Now you're teaching this.
We've taught it. We've actually had television shows out filming us doing it, so that it's been a very successful procedure for us to give long-term results in mid-facial sagging. And it's an alternative, again, to some of the fillers that might be used in the fold, because the etiology or the cause of the deep fold is the sagging down of that mid-facial tissue.
Are the patients, is this for the younger patient? The mid-facelift?
Typically it is. I mean, some patients, this is very often seen in younger patients alone when you have the mid-facial sagging. We'll often combine this procedure with a facelift.
What are the common misconceptions? We're just about out of time. Somebody watching this, fears, maybe lay some of those to rest.
The first ones that people talk about, and facelifting in general, are about anesthesia. Anesthesia is safe now. It's very effective. It's not like it was 10 years ago where there were the gas inhalational anesthetics. For most patients, they can do it with a small infusion. When they turn it off, they're awake and they feel good. So the safety factor is definitely there. It's much riskier for us to drive down Highway 80 than it is to have anesthesia.
Where are you doing the surgeries, by the way?
I do all of my surgeries in outpatient accredited surgery centers. They are, I think, important to do in an accredited facility. Any kind of procedure like this should be done in an accredited facility. Clearly, we want them to be safe, number one, and we want to make sure they're comfortable, number two. Obviously, go along with the effectiveness of the procedure.
Any other misconceptions?
Well, I think that people are concerned about scarring. We've addressed that, Randy. It's hidden. It's very difficult to see. People are concerned about the sort of stretched, windswept look. Done properly, people shouldn't know you had a facelift. And the third one, I think, is in recovery time. People shouldn't be thinking this in months and weeks and years after their procedure. They should be back doing normal social functioning things in 10 to 14 days after the procedure.
Now, on the consultation, do they always meet with you or one of your nurses?
Always meet with me. My patients meet with me. We do a computer consultation and imaging. I'm able to show them what they can look like after the procedure so that they can get a visual perspective of what their expectations
And that's pretty
may.
accurate.
And it's very accurate. When done appropriately, I mean, the key for me is to make sure that I'm giving them an expectation that's reasonable so that at the end, we're all happy about the outcome.
What do you say to the person watching this? They're still afraid, but they want to look younger. But maybe they're afraid of all of the different things that they could be afraid of. What do you say to them?
Well, Randy, we invite them in. I mean, we want them to have a pleasant, nice consultation. We welcome them to talk about their issues. A lot of these patients don't need a facelift or a big procedure. Many of them can be addressed with some of the minimally invasive procedures that are available. Botox, a filler, or even IPL can do a lot of things for people. They don't necessarily have to have surgery or a facelift. So it's great to have them come in and talk about their options and express their concerns so we can take care of them.
Okay, great. I want to thank you for coming on the show. Very interesting.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.